The overwhelming majority of kidney stones form due to inappropriate diet choices. However, there are a few fringe type of stones that form for other reasons, such as pharmaceutical medications, that you may be taking to address other health concerns. Not only do every single drug on the market come with a list of side effects a mile long, but some of them can increase your risk for kidney stones or crystallize themselves into stones. It's absolutely wild. But if you're still suffering from kidney stones and you've done everything you can to prevent them through dietary changes and there's nothing genetically occurring, a medication may be taking you right down the path of kidney stones. If this sounds like you, stick around for this video. Hi, I'm Joey Weichman, and welcome to Stone Relief. The more that I learn about pharmaceuticals and the pharmaceutical industry, the more that I'm convinced that they absolutely do not give a shit about the people they say they care about. Every single medication that they produce to treat a specific condition comes along with multiple paragraphs of potential side effects that can lead to the entire new health conditions developing in the process of trying to treat the one that you're taking the medication for. Now, I am absolutely, without a doubt, convinced that this is an intentional strategy to keep the population at large as lifetime customers, like a perpetual hamster wheel of medication to treat conditions caused by other medications, with you shoving handfuls of pills down your throat, all in an effort to be healthy. I say, fuck that. And today, we're going to uncover multiple classifications of the types of drugs used for a wide spectrum of conditions that can either create conditions in your body that foster kidney stone growth or actually crystallize into kidney stones themselves, all on their own. To start down this insidious rabbit hole, let's set the stage with a little bit of background first. Now, drug-related stones are relatively rare. And when I say relatively rare, it's about 1 to 2% of the stone-forming population. So when you take a look at the entire world population, there's still several 100,000 people that potentially could be suffering from this, and they probably just aren't aware, because not all these stones are going to be visible on your traditional imaging that you would typically get for a kidney stone. They're kind of invisible. They're radiolucent, as you would say. Now, we've kind of grouped these different types of stones into two different groups, and I had to thank my team for doing this because I like the naming this scheme that they came up with. So the first one they've called is the pranksters, and these are the ones that kind of screw around with different things in your body that set you up for your more traditional type of kidney stones. So they play around with things like urine pH, either making it more alkaline or making it more acidic. They'll introduce like higher levels of stone forming elements such as like calcium and phosphate, oxalate, and uric acid. And they also play around with citrate levels, which play a protective role when it comes to like calcium based kidney stones. And then lastly, there's the magicians. And these are like drugs that will actually crystallize into stones themselves just out of thin air, just because of certain conditions that are happening in the body or when the drug reaches a certain concentration. So in the next chapter, we're going to talk first about the pranksters and the different drugs that are going to create conditions that will make kidney stone formation more favorable. Okay, as I had mentioned, the first thing we're going to talk about are the pranksters, and these are medications that tinker with things in your body that make it more favorable for a particular type of kidney stone to form. Now, the first thing that we're going to take a look at is something called a loop diuretic. Now, diuretics are typically used, for a number of different reasons. There's high blood pressure, and in this case, it's for edema, but we also use them for kidney stones. So you're like, wait a second. A diuretic should be a positive thing for a kidney stone, but in this case, loop diuretics work a little bit different. And it's really kind of outside of the scope of this particular video to talk about how that mechanism works. But just know that if you're on a loop diuretic, this could be potentially problematic. Now, the reason that it is problematic is that these loop diuretics actually have a mechanism by which they are increasing the presence of urinary calcium. And whenever calcium gets in higher levels, it increases a risk factor in certain situations. And I say certain situations because calcium on its own isn't really a risk factor. It's kind of like an innocent bystander that gets hijacked during a bank robbery. The bank robbers rush out of the bank, throw like a ski mask on this innocent bystander and shove him in the back. And when the police take chase, I don't know who's a bad guy and who's a good guy or who's an innocent bystander. So it's just kind of like hijacked along. And this is because the different polarity that is occurring with things like oxalate and then calcium, and on the other side of things with like alkaline urine, it deals with phosphate. So increase urinary calcium if you're not eating an appropriate diet as a kidney stone sufferer, which would be either a carnivore diet or an animal-based diet, this could potentially cause you problems. However, if you're eating appropriately, like you should for a kidney stone sufferer, and you're taking a loop diuretic for other types of things, really, there's probably no reason for that, because if you're eating that way, these underlying conditions should go away. But for whatever reason, if you do find yourself on there, excess calcium in your urine isn't going to necessarily be an outright risk for kidney stones. Now, there's also a classification of drugs like carbonic anhydrase inhibitors, and these are going to be used for things like epilepsy and glaucoma. Now, they actually screw around with a couple different things. So there's going to be an increase in urinary pH, making it more alkaline, which can set you up for calcium phosphate stones. And then there's also a decrease in citrate, which also adds insult to injury and sets you up for calcium phosphate stones, because citrate binds with calcium to make it unavailable, like we're talking about more urinary calcium in that last one here, so it can't bind with other things. So what's happening in an alkaline urine situation is not necessarily that polarity that's occurring. However, there is a enzyme that's in factor what happens when your urine goes alkaline that makes calcium more sticky to phosphate, which makes them crystallize. So when you have these two things occurring at once, this can be a big problem for calcium phosphate stones. Now, lastly, as a part of this pranksters group are laxatives, and you'd typically take this as, if you've got constipation or some other medical condition that would preclude you from taking these, or like make it necessary for you to take these things. And there are a couple mechanisms happening here as well. One in which is dehydration, which, as we know, is not a good thing when it comes to kidney stones, because when you're dehydrated, you're not passing as much urine as you should be to clear out all these stone-forming elements that could potentially be collecting inside of your kidney. And the other piece of this is it does increase uric acid levels. Now, if you've watched our video on uric acid kidney stones, you know that uric acid alone is not necessarily a risk factor. You can have sky-high uric acid. You may have other problems like gout, for example, that would be occurring if that's occurring, but that takes an exceptionally high level and a whole host of other like metabolic dysfunction that's occurring. But uric acid in the presence of acidic urine, well, this could potentially set you up for uric acid stones. And unfortunately, most of the Western population, I think I saw a new figure, 93% of us are metabolically unhealthy. Only 7% are metabolically healthy, which is absolutely just wild to me. But chances are you're in that part of that population. You're part of that 93% that are metabolically unhealthy. And when you're metabolically unhealthy, guess what? You have acidic urine. So if you're using laxatives on a regular basis, you're probably making some poor food choices and having to use a laxative, which is setting you up for uric acid kidney stones. In the next chapter, we're going to talk about the actual drugs themselves that can magically form themselves into kidney stones.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
All right, welcome back. Now this is where things start to get a little bit wild. So over here on the right, these are the different types of stone morphology. When I say morphology, it means like the color, the surface, the internal organization that you might see, it's just how it presents itself. And they all might look a little bit different, but I'm going to do my best to kind of talk about a drug and then point over to the stone. So stick with me here. Now the first one that we're going to talk about is magnesium trisilicate. And this is generally found with acid reflux type of medications. And these create silicate stones. And this is going to look like this. Now they're white and very oftentimes can be confused with like a calcium phosphate type of stone. However, with calcium phosphate stones, they have a little bit more of a glassy nature to them, where this is kind of more chalky at best. Now, I've never laid eyes on one of these personally, but I've seen a ton of photos of them, and this is pretty indicative of what it would look like. So if you're passing something like this, if you're taking something for acid reflux, that's probably why. Next, we're going to look at like ciprofloxacin. This is also known as Cipro, very common antibiotic. I remember the first time that I took a trip down to Mexico, I was like, you got to get a prescription for that. I'm like, all right, sure. Didn't end up taking it. However, it was prescribed, and it is a very commonly prescribed antibiotic. Now, this will crystallize in alkaline urine, which is a pH of greater than 7. I don't have, unfortunately, a picture of what that particular stone looks like. I searched and I searched and I just could not find one. But they do crystallize when they reach a certain concentration, and they're also in an alkaline urine solution. Next, sulfa medications. These are really for like HIV and AIDS or immunocompromised individuals who already are suffering to begin with. Now this is just adding some insult to injury. And these actually crystallize in acidic urine, which is going to be a pH of less than 7. Now these sulfa-based drugs are going to kind of take on this type of presentation. Now again, this can vary from stone to stone, person to person, but in general, they're kind of going to take on this almost calcium oxalate type of stone configuration. They look very similar to like a type 1A type of stone or a type 1B, but this is generally what you're going to see with this kind of like reddish nature and coloration to them. Next, there is the triamterene stones, which is again is a diuretic, which we would think would be helpful for us forming kidney stones. However, this particular class crystallizes in acidic urine, again acidic being less than a pH of 7, and it can also trigger calcium oxalate stone formations. And I've got triamterene type of stones here, and sometimes you'll even see this triamterene crystal in the drug itself with calcium oxalate in the same stone. And we'll talk about how we can identify those things in this last chapter, but this is generally what they're going to look like, you know, kind of darkish to maybe lighter brown gray type of configuration with maybe some calcium oxalate mixed into it. And then we've also got indinavir and atazanavir, and these are again HIV and drugs for AIDS and immunocompromised individuals, and they really don't know much about the crystallization mechanism behind these things. It's kind of an unknown, and really it's honestly pretty rare, but the stones that you might form will look a little bit like this. And if you have seen some of our past videos, this looks very brushite looking to me, and this is also potentially another one of those calcium phosphate-ish looking stones, somewhere in the calcium family. So there's a little bit of confusion that occurs, and that's going to make this last chapter important. And then lastly, guaifenesin and ephedrine, which are very common ingredients that you would find in like respiratory medications, cough syrups, and things along those lines. These disrupt the delicate potassium-magnesium balance, and then they cascade a whole other host of things because of that will then lead to their crystallization in the urine. And unfortunately, I don't have a picture of those, couldn't find one. Again, relatively rare, but just know that things within your cough syrup or things for your respiratory medication could potentially be setting you up for their own type of kidney stone forming. So stick around for this last chapter here, and we're going to talk about some of the things that you can do to try to prevent these type of stones. All right, so in terms of prevention, there are a couple different things that we need to do. And again, I just want to be clear here, not a doctor, not providing medical advice. This is just what I've learned in all the research that I'm doing over the last decade, and also in support of the book that I'm writing. Now, the most important thing that you can do is get your stones chemically analyzed. So this means that you need to capture that stone, and ideally you're using a urine strainer to make that a little bit easier, less gross. It's just, you know, pee into the urine strainer and it will capture it there. And then you take it into your doctor or your urologist, and they send it off to a lab, and they do some infrared spectroscopy on it, and will analyze the construction of the stone and get back to you and say, hey, these are the different components that we found. And from there, you can then work backwards to try to figure out what medication was it potentially, or what am I doing from a dietary perspective that's causing this. So that takes us to the next part. And as always, I'm talking about treating underlying conditions. And without, you know, with the exception of really the drugs that you might be taking for like HIV or AIDS, because that's a whole other unfortunate situation that really can't do much about if you are immunocompromised. But some of the other stuff that was been talked about here, you do have the ability to manage better with either dietary modifications. And again, firmly believe human beings, doesn't matter if you're a kidney stone sufferer or not, shouldn't be eating a lot of plant matter, because this sets you up for a whole host of problems, not only when it comes to like environmental toxins, but there's also anti-nutrients within the plants themselves, which will impact absorption and bioavailability of the minerals or the nutrients that are inside them. And there's just like defense chemicals like oxalate themselves and a whole host of other things that plants use to poison creatures from and dissuade them from trying to eat them that I don't really think that we should be consuming. Not at least on a regular basis, and definitely not a part of like thriving as being a healthful organism. It's not meant for us. I firmly believe that. And then lastly, there are some specific herbal remedies that actually, the pharmaceutical industry has based their own drugs off of, but they've kind of adulterated it so they can patent it, make it more potent, and all these different things that they've done to, again, make it profitable for them, and also, I think, keep you on that hamster wheel or treadmill, if you will, of being a patient for life. Take a look at some different herbal remedies. Talk to, a Chinese herb specialist, talk to a naturopathic doctor, talk to your chiropractor. Those guys are a wealth of information. But take a look at some of the other things outside of the pharmaceutical industry because, again, I really firmly believe that they don't really care about you or your health. They just want you as a customer, and they're going to do anything and everything that they can to keep you on that treadmill for the rest of your life. So, educate yourself, make some intentional dietary changes, learn about herbal medications and things that you can use as substitutes for the pharmaceutical drugs. And overall, you'll probably not only prevent your kidney stones, but you'll just feel better in general. Are you spending thousands of hours of surgery just to end up with another kidney stone a year later? Learn everything you need to know to say a big you to your kidney stones inside our free community at kidneystones.com.